Ramadan Mubarak. One of the hallmarks of Ramadan is the Tarawih prayer, and this involves about an extra 1 to 2 hours of worship, mostly while standing on your feet. And as you can imagine, for someone who is sedentary or elderly, this sudden increase in activity can lead to overuse conditions in lower extremities such as heel pain or posterior tibial tendinitis, Achilles tendinitis, things of that nature. In my practice in Western New York, I've definitely seen a spike in these overuse conditions, especially during and after the month of Ramadan. So it's important to keep this in mind when Ramadan's around the corner, especially from an area with a lot of Muslim patients. There isn't really any hard data showing the incidence or prevalence of these conditions during or after the month of Ramadan, and future research is required on this.
Scheduling elective outpatient procedures during Ramadan is not ideal due to the various medications and fluids that patients often have to take during the perioperative time frame, which obviously interfere with fasting. And post-op recovery can also be physically demanding with physical therapy that is often required, so patients may struggle with energy levels and thus compliance. So whenever possible, we should try to plan strategically by scheduling interventions during non-fasting hours. Recommending at-home activities to supplement formal physical therapy would be a great idea. Also, adjusting medication regimens during this time could be helpful. For example, someone taking twice daily oral medications should plan on taking it once in the morning with suhoor and then once after breaking their fast.
Couple of guidelines for the fasting patient during the month of Ramadan in terms of medications. So firstly, if fasting were to jeopardize patients' well-being or their health, then it is strictly forbidden in Islam. Secondly, in terms of topical medications, if the medication is absorbed through the abdominal or the cranial cavity, then it is not allowed. However, for the most part, our patients can receive their topical medications for their lower extremity wound care. And thirdly, IV fluids are not allowed. However, patients can receive medications that are administered intramuscularly or intravenously. I hope this helps, and I want to wish everybody a Ramadan Mubarak.